Well, this afternoon, we're heading to the Upper West region. We'll take a look at the COVID situation there. Well, the police in Wa have so far arrested 83 persons for failing to wear the face masks in public. The arrested persons include 17 females, 66 males. Although the region continues to record increasing cases of COVID-19, the compliance to health safety protocols remains a challenge there. And this has also compelled the police to make those arrests. JoyNews' Upper West correspondent, Rafiq Salam, has a report.
Following the fiat from the president a couple of weeks ago, ordering the Ghana Police Service to ensure the strict enforcement of the wearing of nose masks by the people, the Upper West Region's Police Command for a week first engaged in a vigorous sensitization of the people at churches, mosques, and markets on the need to adhere to safety health protocols, especially the wearing of nose masks. The Upper West Region has so far recorded 220 COVID-19 cases. 65 of the cases are active, 4 at a treatment center, 61 attended to at homes, and 8 deaths. Despite the sprawling figures of the new cases, the people seemed unconcerned, thereby forcing the Ghana Police Service to this morning embark on a special exercise to arrest persons who failed to wear the nose masks. 83 persons were arrested in the 1-hour exercise. Chief Inspector Gideon Boateng is the Upper West Region's Public Relations Officer of the Ghana Police Service.
At about 9 o'clock in the morning, the command went out there. We went to some places like KJTR here in Wa, the main traffic light, the headquarters roundabout here, and then the NIB area. We were able to arrest 83 people comprising 17 female and then 66 male. They all paraded here at the regional headquarters. They were speaking in the north shed. They were giving warning letters to go and be of good behavior and to comply with the COVID protocols. And the next time they will be, their names have been put down. And whenever they accost any of them, they will be put before court.
All 83 persons arrested were each given nose masks by the police.
There are some of them, the moment they see the police, they were having them in their pocket. You see them struggling to remove to wear. Those people, we warn them on the spot and tell them that we let them understand or know the essence of wearing the nose mask and the social distancing. I mean, the protocol to be observed. And then they did understand for that material time. And others too, you see that they don't have it at all. Those that we brought here today, they were not having it. When we arrested them and we were conveying them to the station, the regional headquarters here, where we paraded them, was when we brought an issue to them to wear, because we were conveying them in vehicles we brought to the regional headquarters here. And therefore, perhaps somebody might have been infected, of which that person may not know. So we issued the nose mask to them to wear, let them board in the vehicle. We brought them here, and then we started advising them.
After the arrest, there was a lengthy admonition from the police command, and some of them have opted to be voluntary ambassadors for the COVID-19 fight.
I will never work without nose mask, or even be in the public or any private place without nose mask. Even if I'm even sleeping, I will even use nose mask on that. I will also advise my friends, and also make sure that passengers who join my car, I will also share nose mask to them, and also issue a warning to them.
I have to tell them the COVID-19 is real, so they have to wear the nose mask and give social distance and those things, and listen to the president's directive.
Reporting for JoyNews, Rafiq Salam. Wow.
And I'm taking you to the region right now. Dr. Damien Punyiri is the Upper West Regional Director of Health Services. Doc, thank you for your time. Good afternoon.
Good afternoon.
Let's start with your case count. What are your numbers, and what are they saying to you now?
So currently in the region, total case count is 251, and active cases are 64. Currently, 4 are severe and are on admission. The rest are being managed at home. 11 are moderately ill. So that's the situation in the region.
4 are severe and are being managed. How severe are these 4 cases, and how are you coping with dealing with it?
Yes, so currently the 4 severe cases are in the regional hospital, which has ventilators, but currently none of them need to be ventilated as at now. Essentially, mild difficulty in breathing and other bodily aches, and so they are actually being managed, not on ventilation, but on oxygen. And also the others are also, few others are also in other treatment centers, basically on, just on precaution. They are moderately ill.
So the 251 cases that you have, this is as of, can you give us a little bit of how it snowballed to this level? Was it better as of January? How many cases, for example, did you have in January? And so that we can tell the difference.
So, you remember up to December, let me say up to November 2020, our total case count was 96. And then we started reporting few cases in December, about 4 in December. And then from the first week of January through to now, we saw that the cases have been increasing and increasing. So currently this year alone, we are 154 against the 96 as of 2020. So that's the situation in the
your total number of 251 may be relatively small, but it looks like it has really spiked.
Yes.
Has a spike between just December and now.
We have more than doubled our number from the first week, and this is just over 5 weeks if you look at the whole period. And so you can say that there's a marked increase in the number of cases reported in the region, and this is something that we are dealing with.
Exactly, and I'm wondering what your expectations are, because with the numbers that you have, I'm expecting that you would have started doing contact tracing, which essentially usually will give you a bigger number again.
Of course, that we are doing the contact tracing for every case that we identify, and it is a contact tracing that has gotten us up to this level.
Okay.
Few will come with symptoms, and then when you do contact tracing to the family and to the community, then you get more cases. And so it's a snowballing effect. You get a case, and then you trace, and then more cases come out. So the number keep on increasing. If we stop contact tracing, the number will drop. But of course, people will certainly come down with it. And so we're doing effective contact tracing, and that's why the numbers will keep on increasing. Whilst efforts are being made to ensure that people adhere to the protocols that have been put in place. As you can see from the region, what the security services are doing together with us.
What can you report regarding your schools or schools in the region? What is the story there, Doc?
So for the schools, so far 8 of our schools have reported at least a case. We have traced all these cases. Majority are traceable to different communities. I mean, before, most of these cases were picked on arrival, the first week of arrival after the reopening. And we saw that they came from different locations in the country, including our own region. And so, for example, in 7 of the schools, we picked only 1. We did contact tracing to the schools and then to their communities. And so for the 7, we haven't identified any additional case in the school, but for the one other one, we had a few more cases. So that is the situation in the Upper West region. And currently, I think the cases are doing well. I can say that the region has reported a total of 28 cases among students. 5 have recovered, a few more will recover. Currently, 8 are being managed in treatment centers, basically precautionary. The others are on isolation in the school compound. I mean, the schools have identified places we deem fit to keep them. And so that's the situation in the school.
So help me to understand. I just want to clarify this. You have recorded 88 cases in 8 schools.
No, please. I'm saying that 8 of our schools reported at least a case of COVID.
Okay.
I mentioned that of the 8, 7 reported just a case each. And these cases were traced to family outbreak. We did contact tracing, and so far it hasn't yielded any additional cases in this school. But for one, we have few more cases. You know, we investigated not necessarily from one person from different communities, but about 3 different communities that these cases came from.
I think I got that. What I didn't get was I just wanted to clarify that you have reported in the region 88 cases among students across the region.
No, I said that 28.
Oh,
cases.
28. Sorry, I had 88. I know. That's why I wanted to clarify, just so we don't get the figures wrong. So 28. 28 cases in the Upper East region among students, but then the cumulative figure is 251 for everybody else. What I'm hearing also, our correspondent is reporting that people are still not adhering to the safety protocols, although the police has made some arrests. How worrying is this situation for you in the region, and what is the strategy to deal with it health-wise?
Yes, so it's a situation that we all are worried about because, as you can see, the numbers are more than we anticipated, and the transmission is looked to be quite high. And you expect that the people will adhere to these protocols. It seems, I mean, the adherence is gradually picking up, but we are more concerned about even the right use of the nose mask, not just having the nose masks, but consistently putting them on and ensuring that they don't put them on when they see the security services. So what we are doing is we're engaging with various groups. Yesterday we were with the GPRTU leadership, who also have formed a task force to ensure that the cars arriving or leaving their station, they make sure that all the passengers are on mask. And so we are also engaging the school authorities. The various district assemblies are also meeting and taking measures to ensure that people comply with these guidelines. But more importantly, we're educating the public on the importance of wearing the nose mask, not just because they have to comply with the law, but the fact that it saves their lives and it saves other people. So that is what we're doing in the region.
There have been concerns this afternoon by the National Inspectorate, Education Inspectorate Authority, that teachers or heads of schools seem to be, engaging in some level of non-disclosure. When they record COVID-19 cases, they are not reporting it. Is that a problem for you in the region as well?
Well, I would say that there are reporting guidelines. So when I believe that they usually will report to the appropriate authorities. When we get cases, we inform them, and we expect that they will inform their authorities. But of course, before you do that, I mean, you should not just be disclosing to the general public before the relevant authorities get to know, because we have a hierarchy where that we have to respect when we are giving out this information.
So it is not the case. It is not the case for you in the region that heads of schools are refusing to report when they record COVID-19 cases.
I won't say that it's a problem for us in the region.
Okay. Okay. Doc, is there anything else you'd like to share perhaps for people who are watching you from the Upper West region to understand the seriousness of the situation? You can take it away from there.
I really want to encourage residents, to adhere to this safety protocol, particularly wearing of nose masks. This is the best vaccine for now that we can really use to protect ourselves. Visiting crowded areas should be only when it is necessary, and as much as possible should be very, 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 very short. Like going to the market, you plan what you're going to do, you get in there and do it and go out. The teachers, I think, must also include the protocols. Because we're not going to stop these things for now. So we need to really incorporate that into our learning in the school, teaching the school children to consistently wear them. Right now, when you meet school children, they all have masks. Unfortunately, when they close from school, they just put them in their bags, and then when you ask them before they will start reviewing them. We need to really inculcate in them that they need to consistently wear these nose masks, and I believe that if we all do all that together, we can contain the disease.
I guess that the problem has been for especially the very young ones.
Yes, the
understanding that this has anything to do with my health and whether or not they care. But so then they're having calls for primary schools, kindergartens, for example, to be closed down again. Are these concerns that you, does this resonate with you?
Well, I wouldn't have, I wouldn't want to say anything concerning that, because I know these kids, in the class, they really put on their masks. The only time that they do that, they will remove them is when they are going home. During that period, they are also in the open. So the risk of transmission is quite less. And children are easy to convince. So that's why I say if we consistently teach them what they need to do and that it is for their benefit, I believe that they will be able to adhere to this protocol for the general welfare of all of us.
Okay.
And so I don't think, calling for closure of primary school is neither here nor there.
Okay, Doc. I wish you all the best, and we'll see how it goes. Hopefully, the children will understand that when school closes, it doesn't mean that coronavirus has closed, and that they will keep their masks on even when they close. Dr. Damien Punyinere there, who is the Health Director for the Upper West region.